Right. You get the video finished. Take pictures. No follow.
On that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary to Mahama Cares.
Abusiaha, University of Ghana Medical Center, UGMC, na ohwe edenya esaburuchiri pa na nso ha Ghana. Number 2 women and children edan na esia na busia ye hwe around na ohwe se hospital yi hospital international standard pa na ene Ghana mampani His Excellency John Dramani Mahama adia ose yare crown cro yare awko enko wasi yetuso sa eno nti ene dey no wo padwumadio bi hontoma na ahwe ama won a yare crown cro na your health insurance ne your hospitals ahodo aya na ehoka ewo soro no yebebo modian yetuso sa abusua won car park na ewo ha no na yanyani yenko inside there Mabra ye train say His Excellency John Dramani Mahama bewa bedru na afi yene no atwaso na yahwe ne ya ekoso ewo emuho Ghana News TV so eno ani go ahwe ni Mr. and then they can about hwe me anu subscribe and watch the video e de amame na me kai say wa broche na send this kabafia UGMC na bo me code news say afi na o register na wo monche usika engu botom.
So send this cafe amanoni aba Africa ha UGMC say ye fia wo pese wo nto no UGMC edan ananse japade a wani da so a wo pese oto wa Africa ha no UGMC say wo send this sika amodofo e de aboa no wo Africa ha UGMC sanso e na say wo tie obi school fees amano a UGMC nyenti American Philanthropy ama on say utimi send this sika e fa Philanthropy so a e ma ne begu bank account mu sanso e na timi begu mobile money account mu eno achi nso no de bia Philanthropy e wo daily rate a e ma hu sika dodo a wo send a wo benya Philanthropy e secured na wo send this sika enche na nipa wo send amano no ne nsaka Philanthropy wo USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal, and France. What the Philanthropy send this sika untu ahwe bomodi an dey use me code NEWS news na say ene any day they can register or Philanthropy so a unya bonus sanso and use chance so a ye wo bonuses ahodo a ye de ma.
Finally, have the presidential launch of the Mahama Cares Initiative, which is the Ghana Medical Trust Fund. I tell you something. Yesterday, a Jumara was launched. Today, Mahama Cares is being launched. Tomorrow, the National Apprenticeship Program will be launched. That's not all. Relax. On Thursday, we'll have the Black Star Experience launched. At this time, you can do the round of applause. It is now my distinct honor to respectfully invite the Ejumara, the Commander-in-Chief of the Ghana Armed Forces, the President of the Republic of Ghana, John Dramani Mahama. Please, shall we rise and give him a thunderous applause as he comes to stage to speak to Ghana.
Thank you very much. I mean, the remarks by our sister here, I mean, very touching. And maybe I'll make a few remarks before I inflict the official speech on you. And it mimics almost exactly what the minister said. But I want to say I can empathize with what she's going through, because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you were rich, it was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich. But increasingly, we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawena Dumo. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. These are loved ones that we're talking about. And so, like Prof. Saite said, we must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of one of my confidants and strong supporters when I started this whole political journey. He was an assemblyman, and he was an executive of our party in Bole Bamboy, where I started my political career as a member of parliament. Very close to me, went everywhere with me. Anytime I went back to the constituency, he was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboy like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, he needed more, a dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Komfanoche, where he was undertaking the dialysis. Sold his motorbike, sold his TV. And much as I also tried to support, the cost was becoming unbearable. Eventually, he died. And he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories. And that is why what we're doing today is important, because it will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch. Because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the CHIPS compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We'll have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents in your genes, but a far greater number are lifestyle diseases. They are acquired, they are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from CalBank for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming to help are your clients who save their money in your banks. They are your clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own, your customers and your own staff. And so, I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prof. Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made, and we want to thank you for that. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical circles. And so when he gave the envelope, for a retired pensioned, medical professional, I was curious to see how much he had given. And so after I took the check, I gave it to the health minister. But after a while, I collected the envelope back. And I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much he's giving. Society, a doctor on pension has given $1,000 to Ghana Medical Trust. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary to Mahama Cares. I'm not yet being paid. They say They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares. So thank you very much. Now let me inflict my speech on you. Mercifully, it's short, so you won't have to live through too much pain. Yeah. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals, and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets, and sedentary behavior, and also increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis annually, and that's equivalent to about $3,300 US.
I deem it a great honor to be asked to speak on this historic occasion. Honorable Minister has already summarized our report. You will find data, you will find graphs that tell about the suffering of so many people. But what you will not find in that report are the stories of these people who have been captured as data. People who are broken, whose homes are shattered. These stories broke our hearts. These stories touch us deeply. And I know His Excellency the President will move from resetting our minds to resetting our hearts through this initiative. As a task force, on many occasions, as we heard the stories of patients who are suffering through chronic diseases, we wept. Our hearts were moved. We wept. Our hearts were broken by the state of their lives. And we wanted to do everything we could to help. We also wanted to mobilize as many Ghanaians as possible to support His Excellency the President. There is a story that I'll share with you to end my brief remarks. And this is a story which is referred to as the starfish story. Some of you may have heard about it. In this story, a storm had washed ashore thousands of starfish. And there was a young lady, young girl, who walked the beach and would find a starfish and throw it back into the ocean. Many watched her in amazement. An old man who saw this lady called her and wondered why she was doing that, because there are thousands and thousands of starfish and she wouldn't be able to save them all. Then this young girl, getting discouraged, bent down and took another starfish and threw it into the ocean and said, "This one counts." And soon the old man joined her. And then all those who were looking on also joined. And before long, they had moved all the starfish back into the ocean. Your Excellency, God has used you as an instrument to move or begin to move the hearts of Ghanaians and friends of Ghana and your friends and families to give and give and give and give, so that every single person with a chronic disease will rejoice, will have hope. We can save as many of them as possible so that they can get back to work. In Exodus chapter 2, verse 9, something significant happened. Moses, who had been put on the Nile in a basket, was seen by Pharaoh's daughter. And then, to cut a long story short, Pharaoh's daughter wanted a nurse to look after this baby for her. And Miriam, a sister of Mary, went and called Jochebed, the mother of Moses. And when Jochebed came, Pharaoh's daughter said to her, "Take this child and nurse him for me, and I'll give you your wages." Your Excellency, you entrusted to us this beautiful baby that you birthed. And we have nursed that baby for you. We are not asking for wages. Rather, as chair of the task force, on behalf of my family, myself, we are presenting an adoring gift. It's a token gift to you, Your Excellency. And may this be the beginning of greater things to come. May God bless our nation, Ghana. May we all obey the command of our Lord Jesus Christ. When he said, "This is my command, love one another. Greater love has no man than this, that a man lay down his life for his friends." John 15, 12, and 13. On this note, Your Excellency, I thank you again. And may I humbly ask, that members of the task force stand. I think some of them are right. Please stand and let's acknowledge you. Thank you all very much. I could sleep soundly because they were there to work morning, afternoon, and evening and midnight. Thank you all very much. God bless you.
I think we ought to give the task force another round of applause. And then also thank CSOs, members of the Parliament Select Committee on Health. Also, we are told you did a good job on this. We also have members of Madam Wasi. Mechia President Mahama. Any nature different nyina, any penny for nyina muaha. Madam Wasi, Michiamu. Acho anopa so aye maniji ene mahowa ho say mesumijina ha. Me a diabetic patient. Emri bebre atwemu no. Ye hunu say eye panyifo yare. Ana ne omu sika a omu di srochi ena omu nya sa yare no. But me nim say ade a yare a ebeti maba nkola mu nsusu. Me nya no a check akra. Ba me protect me hu kakra say me sumetina se a check akra. Yare a yare boni pa. Ekum ema we kura enwu. But nyame adom igusu metina se. Nti dia make an say Sisia no ebia ba me bansusu. Me gusu a me solve. But enye yare a ebeko. Ba ye be take care of. Enti dia me di bani se Yakupon emboye na entimi esum. But aliga kra mekani se ye dro no. Eya ne boarding. Me a mejina ha no me a single parent. E won kwala 3 mu. Mintimi hwe fie na ado nyakasa mato na mato amakola no so eye di mame at times dey ebe di kura nyame na ebe mu nti me adis reading say ebe se o ma pani enya ho bua maye ma aduro no na yetimi nya do na yemfa keke yare we afi yeso do say enko bat ye be prevent ma dia onni bi no ono so benya drone bi edia preventing him edanasi say Mahama case na odi buy no edanasi bebre say nyame nhira so na adwempa ayamaye say ofa bi ewo mu maye no embremu Madam Wasi. That's the story of Janet Ashibu. The daughter is also here, but for obvious reasons, I cannot bring her up. I'll try to do a quick translation, except the sochi part. But of course, of the Health Select Committee, please be on standby. Corporate Ghana and our development partners, be on standby as well.
very much. Thank you. Thank you.
Sorry. Who is there? CEO. Why? Why? Campaign, concerning this policy. When we come to Ghana, we be able to check. We be able to Bama, we don't know that. Say, in which Saint La, Ilengua Bogi Senwa, Masters USC or Dale. It's yes, such a Bia Boca. So I want you and be able to be hypertension, be diabetes, be like when you're Bendo. I am with you. Tibokoyo chest so yes, sir. Near Quetia Boca, Tabokoya, okay, come on.
So send this Kefia Manoni ab Africa ha, you slemfy. Say ye fear, wo pese won tono, you slemfy. A dying and answer Japadia when it does so our person to Africa hano, you slemfy. So send this ika, am on the 4 at the Abuano or Africa ha, you slemfy. Sanso and as a utio biscuit fees, amanoa, you slemfy. Yenti I make come full lemfy, am on a say. Put me send this car, FLM5 so a money begu bank account me sanso and it's me begu mobile money account me. And where chinsono, they be a lemfi or daily rater, a more who sika doa or send dia ubenya. Lemfi air secured. Now send this car and check Lenny Power send dia manono, Nensaka. Lemfi were USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal, and France. What the Lemfi send this car? Unchiare. Bombardier they use to be code NEWS News. Now say any day they can register or Lemfi so unya bonus. Sanso and I use to chance so your bonuses are hodwa yadema.
Menu makwekwe sa sempa kania. sɛ menam na mete asɛmpa no ma mo amane a na ma no keka me anyam bia wate ANS Trading Agency Limited nka sɛ woka sɛ door to door foɔ no deɛ ne ɛwatwa ɛsiane sɛ obie ne hɔ a wɔsen wɔn wɔ saa door to door business nim wowɔ nneɔma wɔ UK a wode kɔ Ghana anaasɛ Germany a wode kɔ Ghana 3 to 5 weeks ɛbɛkɔ akɔdu nipa ne pono ano sɛ try na deɛ ma ɔmo dɛm soronko wɔ sɛ adwumadie wei mu ne sɛ wɔn boɔ no ɛda fam sɛ bɔkɔɔ ANS Trading Agency Limited ɛwɔ air freight special service ɛno nneɔma no yɛde bɛfa plane enti ntɛmpa na akɔ akɔdu wobɛtumi afa saa kwan wɔ yɛa so de nneɔma afiri Ghana akɔ UK anaa Germany ɛfɛ gyigyi dɛm wogyina hɔ so agyina yie na men drop bomb no ANS Trading Agency Limited pɛ ɛna yɛ 40 footer ɛne 20 footer container yɛfɛ UK ɛde kɔ Ghana anaa Germany ɛde kɔ Ghana ɔma ma nneɔma ayɛ mmerɛ import o export o dem there for you ɔmo Ghana number ni 0249 170 423 UK ha sɛ wobɛfrɛ yɛn a 0790 802 7527 Germany nso 09173 771 2733 wobɛnya ANS Trading Agency Limited ɛwɔ West Croydon ANS Trading Agency Limited Quantum Brantem wana bɛbɔ yaba so Mary next time in your fill up from the bebro